Hello, my name is Matthew Garcia, and I am a student physical therapist at the University of St. Augustine. Thank you for joining me during this presentation. It may be a surprising statistic to some people that between 20 to 70% of adults will experience neck pain at some point in their lifetime. According to a recent study conducted by Dr. Sinat et al. In May of 2017, published in the Baltimore Medicine Journal, the journal states that a vast majority of neck pain complaints are characterized as nonspecific and self-limiting, but with a high frequency of reoccurrence, meaning that what happens during the first incident could have an influence on future episodes or reoccurrences of neck pain. Therefore, the purpose of this presentation is to expound on the clinical exam findings of a patient that I recently evaluated with an acute right cervical facet joint entrapment and demonstrate the effectiveness of physical therapy in treating that facet joint entrapment. The patient is a 29-year-old female who presented to physical therapy on August 3rd, one day after her cervical pain occurred. The patient reports that she was blowing her nose forcefully while in a rush to get to work. It was during this time, while she was blowing her nose, that she noticed a twinge and painful pull at the right posterior aspect of her cervical spine. Immediately, she was able to describe a sharp pain that shot up the back right side of her neck, and she rated it at 7 out of 10 pain. The patient also noted that because she was leaving to work, she knew she had hurt her neck, but just voluntarily muscle guarded against any movements that would cause pain. After work that evening, the patient reports using a heating pad for 20 minutes, taking a prescribed dosage of cyclobenzaprine, which is a muscle relaxant, and performing gentle neck stretches, which brought her pain down to 3 out of 10. The morning before physical therapy, the patient notes that her pain was still at 3 out of 10 with mild soreness and a minor ache. Interesting enough, the patient's past medical history, she told me that her cervical pain happened back in August of 2017, and the issue has occurred 1 to 2 times every year after that. As previously noted, the patient used the numeric pain rating scale for her pain symptoms. The pain rating scale is between 0 and 10, 0 out of 10 being no pain, and 10 out of 10 pain being the worst pain imaginable. According to Young et al., a study done in 2010 and published in the American Journal of Physical Medicine and Rehabilitation, the study demonstrated that the numeric pain rating scale is a valid rating scale with moderate reliability. The patient's pain was 7 out of 10 at worst, 3 out of 10 on average, and at best as well. Another outcome measure used was the Neck Disability Index, that when totaled, the patient's total disability was at 18%. Based on the Neck Disability Index, or NDI, driving was the most affected functional activity that she had trouble with. Other notable categories on the NDI asked about are personal care, pain intensity, headaches, concentration, work, and sleeping, just to list a few. According to the same article as mentioned above by Young, the NDI is a valid outcome measure with excellent reliability for the patient's functional outcomes with mechanical neck pain. During the evaluation, the patient told me that her goals were being able to return back to the gym with moderate weightlifting, being able to drive without neck movement restrictions, and being able to perform her routine house and work duties without any neck pain. As for the clinical exam findings, the patient presents with a slight forward head posture. There were noticeable limitations with active and passive range of motion. Specifically, backward bending was limited to 25%. After that, the patient was limited by pain. Right side bending and right rotation were also limited to 50% range of motion, and after that, the patient experienced pain. All the directions were normal, and there was no pain. Passive intervertebral motion was used to assess each individual joint segment of the subcranial, mid-cervical, and upper thoracic spine. Notably, there was hypomobility or decreased motion at the C1 to C2, C4 to C5, C5 to C6, and C6 to C7 joint segments. All other joint segments tested normal. No radicular symptoms were noted. The patient tested normal for dermatomal sensations. Myotome and reflex testing were all normal, as well as shoulder range of motion. It was equal bilaterally. The patient also noted discomfort when being palpated for tenderness over the right upper trapezius muscle belly, as well as at the C3, C4, and C5 spinous processes. Lastly, the right upper trapezius muscle and the bilateral subcranial musculature were tight. So based on the patient's subjective history and evaluation testing, the patient presents with signs and symptoms consistent with a physical therapy diagnosis of right cervical facet joint entrapment. The patient has a good prognosis for overall rehabilitation due to being young, being highly motivated to return to the gym, and she is already completing a home exercise program with light stretching for her neck pain. As for the patient's long-term goals, she wants to restore cervical range of motion so that all directions are comparably equal and without pain so that she can continue to drive, go to the gym, complete house and work duties. And another goal for her is that she wants to go at least 1 year being pain-free and together stop these neck pain reoccurrences that she keeps having. The following is a list of primary impairments and the subsequent treatments for those impairments listed. 1. The patient noted increased pain with backward bending of the head, right neck rotation, and right side bending. Due to the patient's diagnosis of right cervical facet joint entrapment, the appropriate treatment would be right side multifidus isometric manipulation. According to Dr. Vitti and Dr. Paris in a case report published in 2003 by the Journal of Manipulative and Manual Therapy, the multifidus isometric manipulation is a safe, non-thrust manual therapy technique that can be effective in reducing pain and increasing range of motion in some cases of acute cervical dysfunction in as little as 1 treatment session. 2. The patient presented with hypomobility at the subcranial and mid-cervical regions of C1 to C2, C4 to C5, C5 to C6, and C6 to C7 spinal segments. Therefore, the appropriate treatment would be manipulation for improvement in joint mobility. According to a study done in 2017 by Lee et al., published in the Journal of Physical Therapy Science, grade 3 and grade 4 manipulations are shown to significantly decrease the scores on the NDI, indicating improvement of function at the neck as well as improving overall cervical range of motion. 3. The patient presented with a tight right upper trapezius muscle and tight subcranial musculature. In a study conducted by Dr. Part et al. In 2017 and published by the Journal of Physical Therapy Science, soft tissue mobilization, self-stretching techniques, as well as retraining of the deep cervical neck flexors had an impact on the cervical muscles as well as cervical posture. Number 4. The patient noted tenderness during palpation at the C3, C4, and C5 spinous processes. In conjunction with the patient's pain, according to a study done in 2017 by Dr. Blandpede et al., the study noted that electrical stimulation could be used for pain control should the pain be persistent or if the prognosis is projected for a long recovery. However, the tenderness should subside after cervical manipulation and stretching of the tight musculature. Overall, this patient is an appropriate candidate for physical therapy and has a good prognosis for recovery in conjunction with a tailored home exercise program and the specified treatment ideas stated above. As previously mentioned before, neck pain will affect anywhere between 20 to 70% of adults during their lifetime. The pain can be related to trauma or a nonspecific event such as an awkward movement like blowing your nose or a awkward sleeping position. Therefore, it is best to seek conservative treatment such as physical therapy so that the likelihood of neck pain reoccurrence is significantly reduced and the functional outcomes turn out better. With that being said, physical therapy can improve a variety of musculoskeletal disorders and improve the overall quality of life in regards to movement and functional activities. Thank you for your time, and I look forward to reading your questions posted below.